Before you have meniscus surgery, you need to listen to this. We're going to go over why having meniscus surgery might not be a good idea. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So let's jump into why having meniscus surgery might actually make your knee worse. So before we go into that, let's talk about the meniscus. So the meniscus is the fibrocartilage between your femur and your tibia. It's that little cushion. And there's two menisci, there's the lateral and the medial, and they provide that cushion of the knee, provide that shock absorption. They also provide nutrition in the knee itself. So it's pretty much a way to save the knee joint from the arthritis down the line. It's providing that padding there. When it comes to the meniscus, there's different ways you can tear the meniscus. There's the traumatic injury, and then there's the non-traumatic overuse injuries. Traumatic, you do some kind of movement where there's some twisting, rotational aspect. You go down, grabbing the knee. A lot of the times you'll see a meniscus tear with an ACL injury, but it's traumatic. There's a scenario where there was a specific incident. A lot of times for people that get older, you'll notice that they won't have a traumatic issue, and it's just over time, they have little minor issues that the meniscus just gets worn down and it's more degenerative in nature. So those are two main ways that you can kind of tear a meniscus. A lot of the reasons why people have a meniscus surgery is because they'll go to the orthopedist complaining about knee pain, and they get an MRI, and when you get the MRI, it shows a meniscus tear. And normally the first thing is, hey, let's get this meniscus surgery. But I'm here to tell you guys the big thing with this is that your MRI has to match your symptoms. And that's a big thing. And we talk about this with a lot of our clients who come in with an MRI, is that first we do an objective test, we see how your knee's moving, and we need to match those symptoms before we even look at the MRI to what the MRI results showed. So when it comes to a meniscus injury, you'll be surprised how many people, if they get an MRI, have a meniscus tear. And you'll be surprised after that, how many people actually have symptoms associated with the meniscus tear. So when you have a meniscus tear, to really have those symptoms is, one, you need to be having catching/locking. Catching meaning you're walking around and the knee kind of catches, or when you try to bend or extend your knee, it catches for a little bit, you got to move it on. Or it might even lock up sometimes, where you're sitting. A lot of times I see people sitting cross-legged, where they cross their legs and then they can't really get out of that position. It locks up in there because that meniscus tear is just flapping around and it gets caught inside the knee joint, and it doesn't let you really extend your knee or bend your knee until you really shake it out. Same thing with the catching. Because that meniscus tear, remember I guys said this is your femur, this is your tibia, it's the space in between. It provides that cushion, that stability there, improves the mechanics there. If a slight little tear is there, it might catch because the mechanics aren't moving as efficiently as possible. So that sliding and gliding of the knee joint is not occurring on smooth surfaces because of that slight tear. Another thing is you're also going to have pain with weight bearing and deep flexion, meaning going into those deep squats, or when you're extending your knee all the way, fully weight bearing, extending your knee, because that's what's going to put the most stress in the meniscus there. So based on that has to match with your current symptoms. A lot of the times, people have that MRI of a meniscus tear and don't have these symptoms. So when they don't have these symptoms, most likely or not, that surgery might not be beneficial for them, because we're going to go over the side effects of the meniscus surgery. So when you have a meniscus surgery, the majority of the time that we see, most people are going to get a meniscectomy. Quick little cleanup. And you'll hear it all the time. It's called an arthroscopic cleanup. They'll go in there, they'll remove part of that meniscus that is torn and try to conserve the rest of it. However, here are the side effects with that. One, whenever you remove part of the meniscus, it increases the contact pressure on the knee joint itself. So what happens is, let's say you have 100% of the meniscus, they remove 10%. That 10% now is, now you have 90% of the meniscus. The contact pressures on that side, they've shown studies that just even removing 10% increases the contact pressure in that specific point by 80 to 90%. They've even shown that if you remove more than half of your meniscus, it increases your contact pressure in your knee by 300%. So when you remove part of the meniscus, you remove part of that cushion, so it increases those contact pressures. which then will increase your risk for early onset of arthritis or degenerative changes to your cartilage. So that's the big thing with the meniscus surgery. So not only will you have surgery itself and have to go through that experience, but it also puts you at risk for early onset of arthritis. And you'll be surprised how many people have a meniscectomy then end up having another meniscectomy surgery or a total knee replacement. So that's the main surgery that usually people have, and those are some of the side effects of that surgery. Other two surgeries, they're not as common and most of the time very rare, but one is the meniscus repair. It is a little bit more common, but it has to be the right size tear and the right candidate. It has to be a younger population, and that's the best kind of surgery you want, because repair the actual meniscus, and that way you conserve the meniscus. That way you're not increasing the contact pressure, you're not increasing your risk for degenerative cartilage issues. So that's the best kind of surgery, but it's very limited. It has to be the right tear and the right individual. The other one is the meniscus transplant. That's for someone that's had multiple meniscectomies and they want to replace the entire meniscus. So they'll get meniscus from a cadaver and transplant that to your knee. Just a longer recovery, takes around a year, but those are the other options. But the most common one, like I mentioned, guys, is the meniscectomy. But the thing is, the big take-home message, guys, is that if you have a meniscus injury, you want to go conservative as much as possible. You'll be surprised how much, overall your knee will get better after doing some rehab. The only time that we would really recommend it is if there's truly locking in there. And we tried the rehab and catching, so then, all right, you might need to have surgery. But you'll be surprised. You do your rehab, your pain will go away, you'll get stronger, and your knee will be stabilized in a better position. Worst case scenario, the knee gets stronger, stabilizes, but you still have some locking. It puts you in better position to have that surgery. That way when you come out of the surgery, you have better results and easier recovery. So big thing is, do your rehab early on after that meniscus tear. Find out if you really have those symptoms, because you might be dealing with some mechanical issues of the knee, some patellofemoral, other issues besides that meniscus tear. So make sure the symptoms line up with the actual testing itself. And then doing your rehab, and then figuring out after your rehab if you truly still have those symptoms or not, then surgery might be potential solution for you. And just know the risks associated with it. But hopefully you guys like this video. If you guys have any questions regarding meniscus tears, comment below, send us an email. We work with people online or in person in Southern California. And if you like this video, subscribe to our channel, share this with friends and family. We are the Basketball Doctors. Let's ball for life.